Hey everyone, and welcome back. Today, we are cracking open the Clinician's Statistical Toolkit. We're going to look at a set of tools that are, and I mean this, absolutely essential for any medical professional who needs to make sense of research. We're talking about parametric tests, the powerhouse methods that help us find the real signals hiding in all that clinical data noise.
So let's just dive right in. But instead of starting with a dry definition, let's start with a real-world, high-stakes problem. You know, the kind of question that clinicians face every single day.
I mean, this is the big one, right? When you're looking at a study for a new drug, you have to ask yourself, is this a genuine breakthrough? Is this a real effect? Or is it just a statistical fluke, random chance? Answering that is exactly why we need these powerful tools.
And that brings us right to the solution. To figure out if something's a breakthrough or just a blip, we turn to a very specific family of statistical methods designed for this exact job.
Okay, so these are your heavy hitters. Parametric tests are incredibly powerful, which means if there's a real effect to be found, they are really good at finding it. But, and this is a huge but, they're specialists, kind of like a high-performance race car. It's amazing at what it does, but you can't just drive it anywhere. The conditions have to be just right.
Now, take a look at this. This slide lays out the difference so clearly. See that first row, data shape? Parametric tests need your data to look like a normal distribution, that classic bell curve. Non-parametric tests, they're way more flexible. They can handle pretty much any data shape you throw at them. That one assumption right there is the main gatekeeper.
So you can think of it like a user manual or maybe a pre-flight checklist. Before you use a really powerful tool, you absolutely have to read the instructions, right? You have to make sure the conditions are perfect. And for parametric tests, that means you've got to check your data's vitals first.
And this right here, this quote just nails it. It's so brilliant. You would never ever interpret a patient's lab value without knowing the normal range, would you? Of course not. Well, it's the exact same logic. You should never use a parametric test without first checking if your data has that expected bell curve shape.
And here it is, the famous bell curve. This is the shape we are looking for. See how it's symmetrical? It just means that most of your data points are all clustered around the average, right there in the middle, and then they get less and less frequent as you move away. This is the pattern these tests are built for.
So let's break it down. For a parametric test to be the right tool for the job, you basically need to check these three boxes. 1, the data has to follow that bell curve. 2, the data has to be continuous, so things you can measure, like blood pressure or weight, not categories. And 3, the groups you're comparing need to have a similar spread. That just means the data isn't way more spread out in one group than in the other.
Okay, so let's say our data passed the check. We're good to go. Now, for the fun part. Let's open up that toolbox and take a look at the 3 main instruments you're going to see all the time in the medical literature.
First up is the absolute workhorse of the parametric world, the t-test. It's simple, it's powerful, and it has one very specific job: to tell you if the average scores of 2 and only 2 groups are statistically different from each other.
Now, you'll usually see 2 main flavors of the t-test. There's the independent samples t-test, which is for comparing 2 totally separate groups, like your classic treatment group versus a control group. And then you have the paired samples t-test. That's for those before and after situations like measuring a patient's blood pressure, giving them a new drug, and then measuring it again to see if it changed.
But what if you have more than 2 groups? What if you're comparing 3 drugs or 4? Well, you can't just run a bunch of t-tests back to back. That's a big statistical no-no. That's when you bring out the ANOVA. It's the logical next step up, designed to compare the averages of 3 or more groups all at once.
And this is a perfect example. Let's say a study is comparing medication A, medication B, and a new medication C. And ANOVA will look at the results from all 3 groups and give you a simple yes or no. Is there a statistically significant difference somewhere among these groups? It won't tell you which one is best, but it's the critical first step to finding out.
Okay, our third and final tool kind of shifts gears. Instead of looking for differences between groups, the Pearson correlation looks for relationships. It helps us answer the question, as one thing goes up, what does another thing do? Does it go up too, go down, or do nothing at all?
And this table here is basically your decoder ring. It's all about that little letter r, the Pearson coefficient. If r is a positive number, it means as one variable goes up, the other tends to go up too. If it's a negative number, they move in opposite directions. And if that number is close to 0, well, it means there's really no straight line relationship between them. It's a really quick, powerful snapshot.
So, t-tests, ANOVA, correlation, we've covered a lot. But let's bring this all back home. Why does knowing this stuff actually give you a real professional edge out there?
Because here's the bottom line. Understanding these tools moves you from just being a passive reader of research to being an active, critical thinker. It lets you look past the headlines and the abstract of a study and really truly judge the evidence for yourself. And that, of course, helps you make better, more evidence-based decisions for your patients.
So I'm going to leave you with a challenge. The next time you're reading a journal article and you see they used a t-test or an ANOVA, just pause for a second. Ask yourself, wait, was this the right tool for the job? Did their data probably meet the assumptions? That one simple question, that's your key to unlocking a much deeper understanding of medical evidence.